What's up guys, it's Drew Dillon from Project Lift, and in this week's video we're going to be looking at pain in Olympic weightlifting. What's common, what's normal, what's not normal. And this is actually going to be a 4-part series for the month of December. We're going to look at pain, and then each week we're going to get into detailed areas of the body and break it down, giving opportunities, solutions that you can do, and then just understanding from a 30,000 foot view on training, how to navigate pain in training and utilize that to get better. So let's get into it. All right guys, so let's talk about pain and let's talk about what's normal in weightlifting. Now, this gets thrown around a lot, and coming up in the sport, I would hear this, the nature of the sport, right? I even have seen coaches celebrate when an athlete sneezes and pulls a muscle in their back that they're doing well. So what's normal out there? And with these beliefs in the culture of weightlifting, how do we navigate what's going to help us reach our greatest potential versus what's going to hold us back? And when it comes down to it, we're going to talk about soreness, we're going to talk about pain, but what I can say right now is a pain that is forcing you to modify your training in any way is not a normal pain, right? There's an opportunity there, and that's what I want to dig into in this video. So let's start off with reoccurring versus one-time pain, right? Now, when we look at a pain for the first time, a one-time issue coming up, there's a huge opportunity. There's an opportunity to make a correction. There's an opportunity to strengthen a weakness. Something happened here. What happened? Sometimes it can be a fluke. Sometimes it can absolutely be a fluke. You tweaked yourself at work, or you slipped and fell. Something happened, and now inside the gym, there's a pain that's forcing you to modify your training. Okay, well, let's modify it and allow you to heal and come back and roll. However, if it's something for the first time happening from training, there's an opportunity there. And it coincides with when we look at reoccurring. So if you have a reoccurring pain that's coming up, that's forcing you to modify training, it's not normal. And it's a huge sign that foundationally there's an opportunity there, right? And when I say foundational, when I talk about foundational work, guys, realize it's different than strength and it's different than technique for the Olympic lifts. It gets into how our muscles fire and work with each other, right? So if we look at the shoulder, are the muscles working in sync with each other, or is there a muscle that's wanting to overwork, to predominantly do all the work, which then makes our shoulder less stable, right? So when we look at foundational work, guys, when we do this type of stuff with our athletes, we have a program called Vital Strength. And what we do here is we allow anyone out in the world to try it for free for a week. And we have a free week coming up, and I encourage you to hop in on it if you're unsure around the foundational work. Come in, experience it, learn about it, check it out, make changes, take this reoccurring issue and get rid of it, right? Because what happens, guys, is something's going on foundationally. If we're talking about our shoulder, say maybe our trap is trying to do all the work, which is leading to pain in our neck and all these different things coming on, and it's forcing us to back down from training. It's forcing us to avoid going overhead, right? And it's happening throughout the year. You get better, you come back from it, and somewhere down the line, here it is again. That is an opportunity to build the foundation. So check out Vital Strength, right? So guys, what I want to get into now is soreness versus pain. So let's dig into that even deeper. All right, guys, soreness versus pain. Now, this is a thing that comes up all the time with athletes, and what it boils down to is being able to understand and tune in with what's going on inside our bodies. What are our bodies feeling? Very often we're disconnected from this, and an athlete will come in and you can tell something's going on, and it's like, hey, what's up? It's like, well, my shoulder hurts. Okay, well, tell me about it. What kind of pain? I don't know, it just hurts, right? That's not a good answer, guys. And we can get a lot deeper. So one thing I'm going to challenge you guys on is if something's currently bugging you, let's practice this together. Down in the comments, go ahead and write out what you're experiencing. So if your shoulder's hurting, ways we can take this deeper is what type of pain is it? Is it sharp? Is it dull? Is there tingly or electric sensations to it? What movements are you typically doing when you feel it? When do you not feel it? Is there a temperature to it? So there's a lot of ways that we can break down and give more description around what we're experiencing with the pain. And that's going to help us differentiate, is this pain or is this soreness? Now guys, soreness is typically dull, ache, some tightness that as you start to move, warms up and then opens, right? Now, when you look at pain, it can be sharp, it can be nervy and tingly, and that tells us a lot around, is it time to go and see a chiropractor, a physical therapist, versus just trying to fix this in the gym. So there's a lot of information to that, guys, right? Now, when you also look at soreness, it's typically even. So if we're talking about shoulders, right? My shoulders are sore. If it's one shoulder, typically something's going on there. We can dig into that deeper. So there's evenness to the soreness, right? Your legs are sore versus a hip, one hip. So keep that in mind, guys. It's a dull ache, tightness that as you start to get some blood flowing, opens up. And when I say that, remember, it's not mobility. It's not taking a lacrosse ball and jamming it in and loosening up everything around it and then going, oh, it's open and it feels better now. It will feel better, but you got to keep in mind, if it's pain, if it's an injury, that tightness is protecting what's going on. So if you strip the tightness out of there and then head into training, you put yourself at greater risk to make this into a longer issue than it has to be. So guys, practice tuning in, practice describing what's going on in your bodies. I would love to hear. I'm curious from you all what you're dealing with. So let's practice that, guys. Write it down. But getting to understand soreness versus pain is huge in making really good decisions about our training. All right, guys, and finally, just reiterating on pain and injury, okay? Now, there's so often I'll ask an athlete, do you have any injuries? Or, are you injured, right? And the answer is undoubtedly no. No, I'm totally okay. And then as we start working with each other, it comes out that they've been modifying their training recently because their shoulder's been bugging them. They don't see that as an injury. If you're having to modify your training, if you're having to avoid ranges of motion, if you're having to change up when you had planned snatch that day, well, it hurts to go overhead, so you're going to do snatch pulls, there's an injury going on. Injury doesn't mean that you're completely sidelined, right? There's a huge opportunity to get in there and do some work about it. So guys, think long vision here, right? You have goals. You want to get stronger at the Olympic lifts. The best way to do that, the easiest way to do that, is to be able to stay on the platform, right? There's an old adage in strength and conditioning, keep the athlete on the field. Keep yourself on the platform. If something starts to come up, there are multiple ways that we can make corrections on the fly, adjustments to where that pain showed us an opportunity that we strengthened, and now you're better for it and you're reaching bigger weights. Right? And unfortunately, there's an opportunity to ignore it to where this pain increases, which then it does put you to the sideline, or it does make us have to adjust in a way that now your gains are being delayed, all because you didn't identify this and make the correct decision. So guys, if you're dealing with any reoccurring pain, if you're doing, any of that, I really encourage you, check out Vital Strength. In addition to that, guys, if you're at a point in your training where you're unsure what to do, we coach athletes. That's what we do. So reach out to us, guys. If you have questions, if we can support you, we would love to hear from you. We'd love to have the opportunity to understand where you're trying to go and help you get there. So guys, I'm really excited about this month of digging into pain. Ask your questions. I'll try to answer as many as I can in the videos. If you ask your question prior to me shooting them, and let's have fun this month digging in to pain with the Olympic lifts, how we can make corrections, and planning for really good gains in the long term. So good luck, guys, and see you next week.